We're good?
Quick question. Is anyone else having trouble with the video fading in or out, or might that be me?
Was Bob Beaver on there? Or Bob is there? Okay.
Oh, Bob is? Okay. Good morning, everyone. I'm going to call the meeting to order. We're a little bit late, but with all of our complications associated with technology and in person, I wanted to make sure at least those that were trying to Zoom in had the opportunity to do that. So first, welcome to the last meeting of 2020 for the CJCC. I think I would be remiss to say this has not been a challenging year on all fronts, public, personal, and otherwise, but hopefully 2021 will be a better year, both in terms of public health as well as getting back to some sense of normalcy. With that said, I'm not going to call the roll. We have everyone either identified on the Zoom TV or here in person, and we do have a quorum. And my sense is that others may be joining us as we progress this morning. The minutes from our September 10 meeting were again included in your materials. I again thank my judicial assistant Jody Saxonmeyer, who takes the minutes, and between she and Mike they craft the substance of what we have discussed. So is there a motion first to approve the minutes as submitted? Motion by Chairman Peterson. Is there a second by Supervisor Fiedler? Any discussions, any motions to amend or otherwise? Hearing none, all those in favor signify by saying aye.
Aye.
Those opposed, same sign. Carried unanimously. Now is the opportunity for public comment. I know we have at least one member of the public here who is a regular attendee at many of our meetings, but is there anyone who wishes to make public comment this morning? I know we also have several folks from DHS who are Zooming in. So is there anyone who wants to make public comment? Hearing none. Under the business item, CJCC and Treatment Alternatives and Diversion Grant Financial Review. Mr. O'Keefe.
Thank you, Judge. We're getting down to the wire for our budget in 2020. We're right on track for CJCC and TAD, that's Treatment Alternatives and Diversion Grant. Just received the third quarter check in the amount of about $29,600 a couple of days ago. So we'll receive one more reimbursement from the state. That'll be probably in February. We have to submit it in January. All other expenses are within prescribed time, budget items, so we're fine.
Is there anyone who has any questions about our current financial situation? Seeing none, thank you. Alternative Diversion Grant 2021 Budget Review. Mr. O'Keefe.
Yes, at our last CJCC Executive Committee meeting, we proposed a budget for 2021 CJCC and the TAD grant. The TAD grant remains the same. The CJCC budget will increase, and the reason for that increase is we're adding a civilian worker in the day report center to help with collection of UAs. And part of the funds to pay for that come from TAD, so we put it under CJCC's budget. Also that comes from treatment court funds and also county funds. So that will increase the CJCC budget, and that's why it looks more for 2021. So what we'll need is probably a motion to accept that budget. Unless there's questions, I'll certainly answer questions.
Thank you. And as Mike said, the increase is related to a civilian who we're going to introduce to the Day Report Center to do, I think, a lot of the administrative types of functions that sheriff's deputies are now doing, and it will also, I think, help us try to triage these people who, albeit are required to test, come in and test knowing that they're going to test positive, which, as I think I've said before, to me is more of a cry of help than it is anything else, indications of criminality. So we're hoping that this person has at least some aptitudes that would help direct and channel that particular population who we see primarily as bail jumps for testing positive. So that was, I thought, a stroke of genius that the sheriff and Mr. O'Keefe and others came up with to enhance that particular program and what we're trying to do with the Day Report Center. And at least to my knowledge, we continue to be the only law enforcement operated Day Report Center in the state, and I think continue to be a model, at least in Northwest Wisconsin, for what we're doing. So is there any questions about next year's budget? Hearing none, and I believe, yes, Mr. O'Keefe.
I just a reminder, next year is our last year of the 5-year TAD grant cycle. So we'll have to reapply in 2022 for another 5-year, that's a competitive cycle, so that's going to take a lot of work to get our foot in the door on that one.
And Mr. Witt, I think, would correct me, but I believe our budget's already been approved by the county board as part of the 21 county budget, but I believe it's certainly appropriate that this body approve that budget, albeit it's already been approved by the county board. Is there a motion to approve the budget then as proposed?
So moved.
And that was?
Mr. Morissette.
Thank you, Mr. Morissette. Is there a second? Second by Mr. Fiedler. Any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Those opposed, same sign. Carried unanimously. TAD grant update. Mike, are you covering that, or Lisa, Kim?
Yeah, we just talked about the budget for next year. Lisa Maltoff is here, and Kim, do you have anything that you want to add for the TAD grant?
Ms. Maltoff?
Mike and Kim and I met yesterday just to go over the 2021 budget and procedures. We're looking forward to working with the DRC to get the testing going again. Just an update for diversion. We've had quite a bit of referrals coming in. And then also MRT continues to be done by Zoom. There is some challenges to that we've worked through. We've been doing that since May, and I think that the clients that are in MRT are getting used to that platform. So it's a little smoother than it was in the very beginning, but everything continues to be going well. I don't know if Kim might have something to add too.
Thank you. I would just add a few things for 2020 yet this year that we have been strategizing about, and I think Judge Waterman is going to give some updates in terms of the treatment courts, but we did have some leftover funds in the 2020 grant this year because when we wrote the grant and created a new position in the 2020 grant, we needed to budget for full benefits for this position, and that position did not take the full family plan of benefits. So we had some leftover funds that we are looking at a couple of projects for, one being a process and outcomes evaluation for both the treatment court and the diversion programs. And a second idea that we came up with yesterday was possible purchasing of mobile hotspots that we could rent or loan to our treatment court and MRT and diversion participants. Most of our services right now are being done telehealth, and we are having some connection issues with some folks depending on where they're residing in the county. So in order for them to participate in court, participate in MRT and their treatment services more effectively, we were going to look and see what it might cost to purchase hotspot units and rent them out to our participants, as well as some safety features to make sure that the use of those hotspots are certainly not abused by the folks that we rent them out to. So a couple of things that we're trying to wrap up yet this year in 2020. And then for moving forward for 2021, I'll just say that the grant that we submitted this fall was in fact approved. So we do have those funds coming in, which will support our diversion treatment court and this new position down in the DRC.
Thank you, Mike. Did you have anything else to add? As Mr. O'Keefe said, 2021 is the last year of the current grant cycle. There are obviously hopes that the legislature will again approve monies for TAD going forward. There's hope that they would increase that funding. They increased it the last biennium. I think they hopefully recognize the benefits that come from that type of funding in terms of treatment and diversion programs. So those are the moving pieces that certainly we have no control over. The other thing that Mike said is that it is a competitive process, and someone will, I'm sure, correct me, but I believe out of the 72 counties, probably 2/3 currently are receiving some form of TAD grant. I can guarantee you that with this next cycle, if the legislature again funds and if the legislature either maintains or increases the money, there will be 72 counties applying. And so the competition stiffens, as well as what I think will be the necessity for creativity and thinking outside the box and making a presentation that hopefully catches the eye of those who review, and I think it's Department of Justice who primarily is responsible for reviewing grants and allocating. So I'm going to, at the next executive committee meeting, suggest that we get a jump start and form a subcommittee to start looking at how we can hopefully present a proposal, a request that is creative and catches the eye of those who review. And we would certainly involve all the various stakeholders who might have some thoughts or input about how we could structure that grant, because I think business as usual is going to be boring. And with 72 counties, as I said, now competing for that limited pot of money, I really think we've got an opportunity here, and I know the judges have, at least informally, had some discussions about, you know, what options or alternatives might be available. So I just want to suggest that that is how I'm going to recommend we proceed and get that process started very early, knowing that, again, it will be competitive and hopefully St. Croix will be successful. Any questions about what I just said or the presentations by Ms. Malthoff or Ms. Kitzberger? Yes, Mr. Fiedler.
Mr. Chairman, I think that's an excellent idea that you just recommended about a subcommittee being appointed next meeting to look into the proposal. Could Mike or somebody just refresh me on what the timeline is for the submission of the proposal?
Normally, they release the grant in about August or September, maybe next year. But I think because it's going to be a competitive grant cycle, they'll probably release it earlier, maybe midsummer.
Hence my thought to get started in January. Any other questions, comments? Thank you. CASA update. Judge Waterman, Mr. O'Keefe, where are we at in CASA?
We reactivated our work on the CASA program earlier this year. You might remember CASA is the court-appointed special advocate. These would be advocates who work with children who are subject to child protection orders and to advocate for their needs. We postponed a lot of work due to COVID. We've reactivated earlier this year in the fall. One of the things that we needed to work out were the details for how St. Croix County would participate in a regional model. You might remember that CASA of Wisconsin is insisting that we participate in a regional model where we have a hub county and then services being delivered out to various other counties. We would be one of the spokes. Barron County would be the regional hub. And the organization that they have created to service this model is called CASA of Western Wisconsin. It all sounds great until you dig down into the details. That's where the difficulty lies. Although CASA of Wisconsin is insisting on a regional model, they don't have a blueprint for us to follow. There isn't a playbook that we can just adopt in our community. So we're really left to come up with the terms and the details ourselves in conjunction with Barron County. So we did have a meeting with the board for CASA of Western Wisconsin, along with officials from Barron County. We expressed our concerns about the need to have some specifics and details before we would feel comfortable releasing the funds that the county has set aside. After that meeting, I had met with the accountant for CASA of Western Wisconsin to get a better understanding of how money would be accounted for, how expenses would be allocated to St. Croix, to Barron County, how we would determine shared expenses, et cetera. But we're still looking for some more guidance about how these two communities are going to interact from an organizational standpoint. As they say, the devil's in the details, and that's kind of where we are right now. So we're waiting on more information from higher ups, and once we get that, we'll be able to evaluate it and then present CASA of Western Wisconsin with our expectations and our needs, and see if we can work out a functioning organizational structure.
As Judge Waterman said, I tend not to wear my emotions on my sleeve, at least in public. I've been a little frustrated with CASA Wisconsin and their insistence that we have this regional model but without any direction. I believe we would be the first region that they're looking at, and so I appreciate that this is a learning process for everyone, but as the judges, I think, are all in agreement, we're not going to be allocating or sending money to anyone until we know what the structure is, as well as how those funds are going to be allocated and what the governance is going to look like. It would be much easier if they just let us have our own standalone program, which has been, I think, the model in Wisconsin up until this regional concept was advanced. So I continue to question why we don't have the wherewithal or the ability to have our own, but apparently this is being insisted upon, I think, first at the national level and then down to Wisconsin. So that's a frustration, because we know that the need is there. We know that kids are being taken out of home, and we have more CHIPS cases now than, at least in my memory, on the bench. And so having those connections and having that other caring adult, you know, we're really, in many ways, kind of missing the opportunity to get that up and going. Part of the detail that Judge Waterman was talking about is, as you might expect, the current board of Western Wisconsin is all made up of Barron County people. There was nothing in their bylaws that said, well, because we're a region, you know, other participants in this program, St. Croix, Polk, Burnett, whoever ultimately may be in, would be allocated a particular number of board members. We've identified 3 people who we would like to be on the board, but again, it's that type of detail that we're not getting a lot of assistance with, and so I think Judge Waterman did indicate to Ms. Schwartz, as well as the accountant when he had his telephone conference last week, is if you're insisting on this, come up with the template, come up with something that we can work with to fine-tune and develop, again, before we start funding it. That's, I think, the devil is in the detail, as Judge Waterman said, and we haven't seen any detail yet. We understand the big picture, but we need some structure. So is there any questions about CASA? Thank you. CJC committee, subcommittee updates. Executive committee, we meet regularly. There is an item, I believe, number 6, that we'll talk about a vacancy that we'll have as of January 4, and that's a separate item. Community engagement, Ms. Caparelli, is there any report?
No, I think we were kind of focusing in on the CASA and diving deep into that.
Judge Nordstrom, anything from criminal justice?
I would ask Mike if he wants to update the committee at all on the risk assessment issues that we raised, but we talked about pretrial risk assessments and the current state and the potential for changes there. That's one topic we addressed in October. We then had, I think, a pretty good discussion about the whole general idea of looking for alternatives for those who are suffering from various forms of substance abuse that come to the criminal justice system, and how I think it was generally thought we need to look at a more holistic approach from all the services that might be available in the county, whether it be the health department or the court system or diversion programs or local treatment providers. But I think, at least speaking as one judge, that I'm often a little frustrated at the limited number of resources and options that we have in addressing all of the day-to-day substance abuse victims, essentially, that come before us, and we have limited options to help them. And so I think working with the Sheriff's Department and others, if we could just have a better sense, I think as a judge, I'd like to have a better sense of all of the resources that would be available, and to try to stem the tide. But in any case, it was a good discussion, and we had great input from the County Health Department, and I thought that was very helpful, and hopefully we can continue to have communication in that regard. But I'd let Mike update on the pretrial risk assessment issues if he'd like.
I conduct pretrial risk assessments for intake just for felony cases. Really, with being one person, that's the only amount of time I have to give to that. For instance, on Monday, there were 7 felony cases listed on intake, and I did pretrial risk assessment, and it took me a solid 5 hours to get those done. What I'm finding in the pretrial risk assessments are the cases involving drugs, more specifically methamphetamine, tend to be the higher risk cases. And really, when you do a pretrial risk assessment, you're really only looking at a couple of things: whether they're going to return for their court dates, and if they're going to engage in criminal activity while they're out on bail or bond. So the meth cases, people addicted to methamphetamine, it's very difficult. They don't tend to have jobs, and I'm generalizing here, but they don't tend to have jobs. They don't have stable housing. So those are the risk factors for them not returning to court, or they come in, and give them credit for coming in, and they will test probably dirty for, more methamphetamine when they take a UA, which equates to a bail jumping charge, by law. So the pretrial risk assessments, we can use that tool, but you also have to use professional judgment. And I think we have judges and district attorneys and public defenders that know how to interject those things into the equation here and make something that a bond condition that makes some sense. And with the Day Report Center, though, however, we know these cases are out there. I've been keeping track, and methamphetamine by far is the most prevalent drug in our community right now. I'm not saying it's the most dangerous, but I'm saying it's the most prevalent. And those cases take a lot of time. And when I say cases, I'm talking about people. So I don't want to make it sound like I'm not talking about people. So we could expand that program, but it would take more staff. Again, it took me 5 hours to do it on Monday, and that's I'm one person.
Years ago, when I was on the statewide CJCC committee, Mike, there was this hope, aspiration to roll out a more simplified risk assessment tool. We're using Compass, which requires, interviews, and it requires, I think, as you said, a lot of energy and time. I know it had been rolled out to some pilot counties. Do you know what the status is of that? Because I understand that's a non-interviewed
Yes, Your Honor.
assessment.
It's called the Public Safety Assessment, and that one is just using static information. You don't have to interview the person. You do a criminal history check, and you can take most of that information from there and come up with a pretrial risk assessment. The one that I see that's out there that's working right now as part of the pilot program in Wisconsin is Dane County. And I sent you some information on that. And but they have 5 or 6 people that are doing pretrial risk assessments full-time.
County board,
Yeah.
we get like 5 more people?
So anyway, it's supposed to spread out to us, the public safety assessment. I know we probably could use it right now, but to implement it without resources would be, it would fail, so.
So maybe Judge Nordstrand, your committee can look at a watered-down version of something. Because as Mike said, we get the compass assessments, and they're very useful, and I can't tell them enough how much that's made a difference in our bond analysis. And then we consider the DA's assessment, we consider the public defender, defense attorney's assessment. But a lot of this is still gut, and I don't know if that's a judicial term or not, but it's gut and common sense about what we believe is the risk ultimately. So if there's ways, again, to scientifically or evidence-based, whatever term we might want to put on that, I think that only, again, becomes a better tool for us to use. So thank you. Any questions of Criminal Justice Subcommittee? Domestic violence, family issues?
Agnes?
Yes.
I have a question.
Yes, Ms. Rain.
Could you help me understand? Can you give an example of, okay, when you do this risk, and then you just described, well, there's high risk, there's low risk, you make a gut decision. What are the examples of those 2 decisions? So if there's high risk to the public, what is your decision? Is that?
Yeah. And again, maybe I should be a little more careful. Under the Constitution, the only basis for which we can require cash is on likelihood to return. In other words, will
so
this...
this is all about bail?
This is all about bail.
Oh.
This is all about bail and assessing, likelihood to return. Now, interwoven in that is risk. Is this somebody who has a lengthy criminal history? And obviously, in our opinion, based on a criminal history, are they likely then to return? Public safety, I think, for many judges, weighs into the balance in terms of setting bail. But in the compass assessment, Ms. Ring, Mr. O'Keefe will tell us this guy has, or woman has, 5 prior convictions, and based on the records that they're able to review, they missed court over the span of their criminal career 5 times. Well, that's a good indication to us then that maybe this is a case where we want to look at cash because of likelihood to return to court. So that's the starting point. Are they likely to come back to court? Non-residents of Wisconsin, our abilities to snap those people up and get them to court is a little more challenged because once they cross the state line, which is closer to the government center than Roberts, we lose a lot of our ability to protect the public. So, residential stability, employment, family support, AODA issues, pretty much everything you would expect goes into that formula that I then, in my head, try to come up with a risk. And is cash needed? This case where we can put them on a signature, require that they test, require that they call in. So that's kind of the analysis that we go through.
Okay, thank you.
You're welcome. Any other questions? Family issues and domestic violence? Mike?
Yeah, I'll speak for Judge Black, and unless I think Tim Heckman's out there, maybe Commissioner Heckman might want to say a few words, but we have our next meeting in December, and I think Mr. Heckman's going to give a presentation about some parenting class issues and things like that. Are you still out there, Commissioner?
I am still here, Mr. O'Keefe. Thank you, and that is indeed correct.
I think Chief Richard is on. I know, Chief, North Hudson was instrumental in helping develop, the domestic violence lethality and rolling that out. Are all agencies now using that, to your knowledge?
No, Your Honor, not all agencies at this point. We have expanded, and Hudson PD has been trained. I believe New Richmond either has been or is in the process of, they've done the train the trainer and probably ramping up the expansion into their officers for their training. That's what I know of at this time. I don't know if anyone from Turning Point is on the meeting that might be able to update on what they may have been done training. I assisted Hudson PD with their training of their officers, and so I do know for a fact that they are up and ready. Whether or not they've actually put it into play policy-wise or if they've started doing the lap, I'm not sure, but I do know that they're ready to go, so we are moving forward.
Thank you. And again, I will speak for myself, but I think the other judges probably would agree that I'm hearing, and it's the agencies you've just referred to, Chief, that I'm hearing it in prelims and reading it in criminal complaints that they've completed that assessment. And a lot of information is gained that maybe in the past has not been gained associated with those types of cases. So if there's anything we as judges or the CJCC can do to encourage rollout of that among our smaller agencies, again, I think it is beneficial on so many fronts in terms of public protection, in terms of prosecution, in terms of providing services. Sheriff, are your officers all trained on the lethality report? Yes. All right, so the Sheriff's Department is trained. Any other questions on domestic violence or family issues?
And Judge Tim Heckman here, just to add into the mix, I think part of the presentation we'll be making to the subcommittee in December is going to emphasize the kind of the focus of that subcommittee, more gearing towards the combination civil family type situations as opposed to the domestic violence court that Judge Lack already has up and running. So a little change in perhaps our focus there. And we've had some training and coordination with Turning Point, Victim Witness, the Bar Association, et cetera. So we'll have more information there. We can present to the whole committee perhaps sometime in 2021 as well.
Thank you. Any questions? Moving on to mental health. Mr. O'Keefe.
I just want to say we had a meeting the other day, and I'm going to let Bob Rarrett give a briefing on this, but Bob, would this be a good time to introduce Shar? I think Shar Lopez is on. Was on. I think I don't know if she's still there or not, but Bob, and I know Supervisor Fiedler's interested in this summary, so Bob, I'll let you give a summary of our meeting.
Sure, thank you, Mike, and I do believe Shar is on. I'll just briefly introduce her and then let her speak a bit about her new role as Behavioral Health Administrator. Shar just began employment with us last week ago, last Monday, and has a lot of experience in behavioral health and also comes with a wealth of experience having worked for the Minnesota Department of Corrections. So I'll let Shar introduce herself and then I'll move into a summary of our subcommittees.
I don't know if my camera's on. I don't think it is. But I'm Shar Lopez. As Bob said, I come to you from the Department of Corrections. My last 7 years I spent at the Oak Park Heights facility. I worked both in the inpatient behavioral health, the mental health unit there, and the outpatient. I oversaw the living units, including the restrictive housing units, and spent a good chunk of time doing some recalibration of the way that we had worked with those who were in restrictive housing, creating some evidence-based interventions to assist in reducing risk to themselves and others before being placed back into the general population. Prior to the Department of Corrections, I had actually started my career working in human services and child protection, worked in Burnett County. I worked in juvenile up in Douglas County, and did some mental health and school programming, some higher education. So I come to you with a lot of really great ideas and a lot of energy. I'm super excited to be with the St. Croix County. Thank you.
Welcome.
Thank you, Shar. We're very happy to have you. Mike, would you like me to move into a summary of the subcommittees?
Yes, Bob, please.
Oh, okay. I think it might be helpful to provide a little framework for both subcommittees to give you a better sense of where I think things are going. And then I can speak specifically to a couple of items in each subcommittee that might be of interest. But yeah, I come from Minnesota as well in terms of the last 8 years of where I've worked in. I was very involved in behavioral health reform efforts in Minnesota, largely related to addiction care, but also with the integration of mental health and addiction care in Minnesota, which requires obviously a modernization of the system as it currently existed. So we had to look at a number of ways in which to restructure behavioral health services to address some of the things that were mentioned earlier around holistic care, whole person care, and how to integrate behavioral health with the rest of healthcare so that reimbursement rates were more in line or in parity with the rest of healthcare. So there's a huge undertaking that's involved in taking an antiquated system and trying to modernize it and make reimbursement rates enticing for new innovative kinds of efforts. Having said that, it looks like Wisconsin is in the early stages of doing a similar, making a similar effort. What this primarily involves is it involves, first of all, designing or adopting a system of care that they want to strive towards, and then looking at Medicaid restructuring in their state plan amendments so that they can design reimbursement and design rates that match the needs that they've identified in their overall strategy. And Wisconsin has received apparently the 1115 waiver, which is a federal waiver that allows for federal funding to flow into institutions for mental disease or facilities with more than 16 beds, which currently is excluded under Medicaid. So that's a big deal, but the 1115 waiver also involves system restructuring. So it's not just a waiver you sign and say, thank you, and now we can get funding. It involves statewide systems reform. And I believe Wisconsin has approval from the Centers for Medicare and Medicaid for that waiver, which is good because then that provides the structure, the framework from which they can then develop systems changes. I'm trying not to put you to sleep or confuse you with the details. So the effort right now with the substance use disorder area is to look at rule revisions and Rule 75 that align with that waiver, that federal waiver, and that provide additional services to our communities, such as peer recovery support, care coordination, case management, and a broader array of engagement types of service areas. The idea of a time-limited, prescribed sort of treatment environment that we've all become accustomed to over the decades is going away, and the notion of treating addiction like a chronic illness is starting to take hold, has taken hold in many places, but is starting to take hold here. The idea there is to treat addiction as you would other chronic disease, such as heart disease or diabetes, asthma, things like that. And by doing so, you have to then provide preventive care, and you have to provide different levels of care that match the severity of the individual or the community where you're serving people. So what we did in the substance use disorder or the Substance Abuse Subcommittee. What I mentioned earlier in that subcommittee was that we had applied for a behavioral health home pilot project that the state had provided a request for applications for. And we were hoping to be a pilot site for this behavioral health home and be the hub for that, so that we could take advantage of some of those changes to Medicaid and provide services to the jail, to the homeless populations, and to other populations through medication-assisted treatment, and get reimbursed for that and pilot that effort. We didn't get we weren't selected as one of the pilot sites, unfortunately. I don't know who was. But that effort will continue likely, and if the outcomes are good, that will be replicated around the state, which then we could take advantage of. But the other effort in that subcommittee that I'm interested in exploring with the group is to see how other similar kinds of efforts are playing out at the state level, so that we can be at the forefront of piloting or engaging the state in those efforts. And some of those involve the things I've already mentioned, engagement strategies. How do we engage people who need addiction care differently than we have been historically, rather than having them come to office visits, going to locations or places where we can serve them in the community and maintain those relationships with them, which is key to keeping them engaged in the healthcare system and preventing them from going to jail and getting sicker and going to hospitals. That's sort of the overarching strategy that the state of Wisconsin, I believe, is undertaking, and that we'd like to support. And internally here at HHS, develop our own internal behavioral health system that mimics that kind of strategy. Just quickly, if I could just recap our mental health subcommittee meeting Tuesday, I believe. The focus there was on emergency psychiatric services and the lack of psychiatric beds in the state, especially in this region, and any efforts currently underway to address that issue. There was a Senate Bill 405, I think, that died in the Senate last session, that would have allowed the state of Wisconsin to allocate $15 million to Eau Claire to expand their psychiatric beds in one of the hospitals there by 22 beds. While that died in the Senate last session, there is some interest now in taking that up again and looking at the potential for funding to do that in Eau Claire, which would, I think, be a good thing because of the lack of regional beds. Senator-elect Stafschel may come to our next mental health subcommittee meeting to speak to that. I understand that he's an advocate for that effort. A caveat to that real quick, though, is in the long term, just creating more beds is not a solution to the mental health crises that we're facing. So these other larger systems change efforts would be the long-term solution to reducing this need for crisis beds, but that's years probably away. So in the immediate future, this effort to find funding to expand bed capacity in this area would be a reasonable strategy to address the immediate needs. The person that spoke at our mental health subcommittee was Matthew Stanford, who's from the Hospital Association, the Wisconsin Hospital Association. And he spoke about some of the Medicaid restructuring through the state plan amendment that I spoke of earlier, in which we might be able to look at rate adjustments for psychiatric services or crisis services that would give a higher rate to the providers and incentivize them to some extent, or subsidize them to continue providing crisis services at a higher rate. It's all connected to waivers, and it's all connected to system reform, and that's what we're keeping our eyes on at this point. But right now, I'm trying to read the tea leaves and put the pieces of the puzzle together to see how we can, at St. Croix County, be on the front edge of some of these changes and take advantage of them. It's not unlike, the aspects of it are not unlike the CASA program, where you have people with lived experience or peers or people who are engaging people with these needs differently to keep them involved in the healthcare system. addiction and mental health are healthcare issues. They're not some separate, weird, condition. They're a healthcare issue. And as the closer we can get to treating them as such, I think will get us out of the habit of reacting to crises and proactively addressing them. Mike, I hope I summarized some of the things you wanted me to talk about, but I'm happy to answer any questions without going on at this point.
Are there any questions of Mr. Orat or Mike about substance abuse or mental health? Allison, as I understand, the hospital associations in western Wisconsin looked and concluded it was not viable for them to develop, but my sense is that you're certainly on board with what we're trying to do here locally.
Yep, absolutely.
Thank you. Any other questions or comments? Thank you very much, and again, Bob, thank you for your leadership. I can tell you as judges, we're always envious of whatever Minnesota has done, at least in terms of this Rule 25, which we don't have, but what really appears to be a panacea in that state, and the numbers of people who we hear about, doing a Rule 25. So I thank you for bringing that background and experience to Wisconsin, and specifically western Wisconsin. Treatment courts, Judge Waterman.
Thank you. I just have 2 points to report on. One, Kim introduced earlier, and that is the process evaluation and outcome study that we'll be doing. The treatment court has been operating for about 15 years now, and during that entire time, the coordinator has been collecting various forms of data. And some of it you've seen and heard from, or heard about, how many people we have, what are their ages, what's their drug of choice, how many graduate, how many commit new crimes, stuff like that. But we also keep a lot of other data points, for example, how many dosage hours they have in treatment, how many times they go to an AA meeting, how many times they've been sanctioned, how many times they've gone to jail, how many days have they spent in jail, how many times they are given congratulations, how many times they're given an incentive, and the list goes on and on. So we have all of this data, and it's really beyond our ability to assess and understand, with the exception of perhaps the most general forms of data. So we have approached Professor Phil Galley over at UW River Falls. He comes to CJCC too, so you may have met him. He and his team at UW have agreed to do a process evaluation and outcome study to look at all of this data and assess it, to give us a report. Hopefully we'll find out what we're doing well, where we need to improve. For those things that we are doing well, why are we doing well? And then let's repeat it, let's replicate it. If there are areas that could use improvement, we need to identify them and find ways to achieve improvement. I think, have we lost the people on video? Okay.
We're here.
Okay. We thought we lost you there. So in any event, Professor Galley has given us a very reasonable estimate on the cost. The cost will be covered by available TAD funds. Because of changes we had to make to the program, we have a surplus of TAD funds that we'll be able to redirect to the outcome study. And hopefully we'll have that sometime in 2021, right, Kim? Okay. The second update I want to share is about COVID-19. And let me just share a story or an anecdote before I get to the point I want to make. In treatment court, we deal with participants who are addicted and they're at high risk of relapse. We have at times debated what it would look like if we could achieve the opposite of that state of being, what the opposite of addicted and high risk of relapse would look like. You know, how can we chart a path for an individual to get away from that life of addiction and get to a place that is healthy? So we've debated, we've wondered, what is the opposite of addiction? And my initial reaction was, well, that's easy. It's sobriety. And one of our team members quickly pointed out, no, it's not sobriety. Sobriety is not the opposite of addiction. The opposite of addiction is having a human connection. The opposite of addiction is community. Because it is oftentimes when meaningful connections are missing from people's lives that they resort to drugs and alcohol to fill that void. And oftentimes that leads them to a place where they disassociate with others and they lose those meaningful connections that make us human beings. And that's one of the reasons why our program requires meaningful engagement in pro-social activities. Things like AA meetings, NA meetings, having a sponsor, doing step work, things like that. It connects them with a social support network in the recovery community so that they can reestablish those meaningful human connections and walk away from and leave drugs and alcohol behind. Well, when COVID-19 hit, we lost that ability. We were told to isolate, we were told to stay away from people, AA meetings closed, sponsorships were difficult to find, and a lot of our participants struggled. They had a difficult time with it. And we on the treatment court were faced with the difficult situation of how do we be responsible with one public health crisis while trying to address another public health crisis, that being substance use. You know, I don't know how they do it. I certainly don't deserve any of the credit for it. But the treatment court team manages to work exceptionally hard and come up with creative solutions to keep the program running and, more importantly, to deliver important services to the participants. That not only helps themselves, it helps their families, and it helps our community by keeping people crime-free and away from dangerous drugs and alcohol. It seems that Kim is in my office just about every day, and she usually has the problem of the day. This participant is struggling. This participant did this. We need to address that. But we have an unwritten rule on the treatment court team, and that is you cannot bring up a problem without having a solution. So I have to compliment Kim and Tina for their ability to not only identify problems, but deliver meaningful solutions. But they don't deserve all of the credit either, because they also work with a frontline team from DOC, Emily Anderson and Tessa Marty, who supervise our participants, Kayla Turpin at Behavioral Health, who provides meaningful AODA services. We have Randy Hart at the Sheriff's Department. These are the frontline workers who are dealing with participants, who identify the problems and know what the solutions would be to help these individuals. And it would also be remiss to overlook our partners at the Report Center. They're not part of our team, but we couldn't do our job without them, and they are meaningful to our work. So I bring this up today because their supervisors are all here in the room or they're on Zoom. And I think it's important that we recognize good employees when they're doing good work and hard work and coming up with creative solutions to a very challenging public health crisis, that being AODA in the COVID-19 era. So that's my report. Thank you.
Thank you. Any questions of Judge Waterman about the treatment courts? Hearing none. The next is CJC Executive Committee at Large member appointment. The Executive Committee of the CJCC has 5 members. 3 are determined based on the bylaws. Presiding judge is automatically on, chairman of the county board is automatically on, and the county administrator is automatically on. There are 2 large members, Kate Avalos being one of them, and then Mike Nieskus has been our other at-large member. I think, as all of you know, Mr. Nieskus is on the cusp of retirement, having not sought re-election, and will be basically giving up that office as of January 4, when his successor, Carl Anderson, who I was on the call as well, will be taking over the responsibilities as the elected district attorney. We thought as an executive committee it prudent at least to bring that to your attention that we will have a vacancy on the executive committee. Our preference would be to fill that so that when we have our next executive committee meeting, we're at full complement. So, and a little bit later in the meeting, we'll recognize Mike, but knowing that we will have a vacancy and knowing that any other member of the membership is eligible for that at-large position, are there any nominations to fill that position on the executive committee? I'm sorry, Mr. Niskas. You're muted, Mike.
There, I think I figured it out. Judge, I'm going to nominate Carl because I think it's important on the executive committee because so many of the program, the district attorney in terms of the criminal justice matters, runs through the DA's office in one term or other, that Carl will be taking my place on the CJCC committee, but he also be placed on the executive committee. He'll be attending regardless. We've had discussions about that with the meeting, but I think it's important. So I'm going to nominate Carl.
Thank you. Is there a second for Mr. Anderson?
Second.
By Mr. Fiedler. Other nominations for the executive committee? Any other nominations? Hearing none, is there someone who'd like to make a motion to cast a unanimous ballot for Mr. Anderson as a member of the executive committee commencing with his term on January 4?
I'll make the motion as
Motion by
described.
Chairman Peterson, second by Supervisor Fiedler. That's not debatable. All those in favor signify by saying aye.
Aye.
Those opposed, same sign. Congratulations, Mr. Anderson. I don't know if you're live. Move so we know that. Oh, okay.
I'm here, thank you.
You're welcome. And Mike O'Keefe will reach out to you with our bylaws, membership lists, some of the past minutes of our meeting. I know that you've been participating at least as an observer for a number of months, but we'll get you up to speed. Circuit Court updates, there's really not a lot to report. If you are interested, we are in the process of completing a significant technology remodel of all the courtrooms. 3 are, I want to say done, but they're 90% complete. And I think even as we speak, the contractors are working in Judge Vlack's courtroom, which is a little more challenging because he's the courtroom that has the DAR set up, the digital audio recording system. Certainly come up and take a look. I can tell you the project's been somewhat challenging as we're trying to retrofit a building that was built in 1992 with no thoughts of computers, arguably, in terms of a lot of technology or audio-visual. And I can't thank Judge Nordstrand enough for spearheading that effort and coming up with the design and overseeing a great deal of that project. So come up and take a look. We again thank the county board for their capital improvement support for the project. I think we're at budget, at least that's the last I heard. When the contractors are done, then the technology people from the courts, from Madison, hopefully can get up here and do some things with the microphones and other systems that will enhance these developments that we're making structurally to the buildings. One of our court security walked in and thought he was in Buffalo Wild Wings, but anyway, when you walk in a courtroom, you'll maybe get the connection that he made, given the TVs that are hanging now from the ceilings. Jury trials continued. Yes, Mr. Judge Nordstrand.
I just want to say a special thanks to Jim Ellsbury and to John Allegro as well, because it's been a combined effort of our facilities needs, and obviously that began with remodeling courtroom 1 for our COVID-19 jury box, et cetera. But that sort of kicked off this whole process of updating the courtrooms for technology. You know, we began with a sort of an immediate need to do Zoom. And so the efforts of both our IT department and our facilities department have been extraordinary. And they continue to, you know, bring us new ideas and to present proposals that are, you know, cost effective and within budget. And that's, you know, certainly testimony to their efforts, and I just want to make sure we're clear about that as well.
And Judge Nordstrom is absolutely correct. Jim Ellsbury and his crew do so much behind the scenes that I don't even think we appreciate, A, because they get it all done before 8 o'clock, which is when we start court, because as you know, in this building, if they're working in the jail, we can hear it up on the second floor of the courtroom. So they do most of their work before our hours and after our hours. John Allegro, as Judge Nordstrom said, has been absolutely phenomenal. Given security issues, the contractors did not have background checks or things initially, and so he basically transplanted himself to one of our courtrooms with his computer, did his work there, and monitored these employees of the subcontractor to make sure our security protocols were being followed. They got clearance last week, so he now is back in his office, and they can do their work without, not babysitting, but without that supervision.
Could I just say one last
Yep.
thing? And I think it's, the process has been good in terms of sort of future-proofing what we're doing, too. One of the things that you may not have been aware of is, to the degree that we had audio-visual capability and our video conferencing capability, it was all done on a courtroom-by-courtroom basis. So if you looked underneath the bench of each judge's bench, you'd see a black box, and that was the black box that ran your courtroom audio-visual. Part of this process has been to change the whole system to a server-based system to deliver much better services, much more elaborate services with more TVs and all these capabilities. But we jettisoned a Pepsi machine out of one of the rooms in the back of the hallway, and that's now our new server system for all 4 courtrooms. So we're running it together. And as we look at things like future expansion in terms of whether we ever need another courtroom and that kind of thing, this will allow us to continue to use that facility to expand out this technology. So it's been not just a change, it's been a significant improvement of the system itself, I think. So, and I want to congratulate again John Allegro and his team for getting that accomplished.
I don't want to belabor it, but because of the way the old system was, each courtroom was different, and so our clerks had to learn how to do the technology in each courtroom. So last night in the hallway, there was some discussion about now all 4 courtrooms be consistent, and that they've tried to make it at a level that Judge Vlack could understand. They concluded they couldn't put it at a level I understand, so at least they're going to go to Judge Vlack's level, and then hopefully I can piggyback along in some way. But again, that was the discussion last night. Jury trials continue to be conducted in Judge Nordstrand's COVID courtroom, so to speak. I will be candid with this body that we are struggling, I think, as a system, as a court, as a district, about an executive order from our governor that is encouraging people to stay home, and a system where we expect jurors to come into a public building. I have no answers. I have no prognostications. The governor's orders have always exempted the courts from those types of dictates or those types of recommendations, I guess in this case, or guidelines. But we're trying to put ourselves in the position of jurors who are sitting at home going, well, the governor's told me to stay at home, but I've got a summons to come serve jury duty. And I don't have an answer. We're going to be discussing that at the district level. I don't expect any information or guidance from the state per se. They've pretty much said every county needs to decide what they want to do. So we're going to talk about that in terms of what that looks like and how we can reconcile that arguable contradiction for operation. We have somewhat of an issue, and I'm glad, I think Ms. Osberg was on, maybe she's dropped off. We've had one of our public defenders resign and is moving back to California. Generally, St. Croix County should be assigned 4 public defenders. For the last year plus, we've been operating with 3. Now we're going to be down to 2. It's not sustainable, and Ms. Osberg and I have been playing telephone tag because it's impossible to run our criminal justice system with only 2 public defenders. I know that they have been working diligently to recruit and train and hire attorneys, but that came as really a shock wave, which is going to be a tsunami in terms of processing those people who don't who qualify for their services. The 2 that we have left are phenomenal, but to expect them to pick up another basically full-time job is not realistic. So that's one thing we are going to address. Any questions of the courts about what's going on or where things are at? Sheriff's update. Sheriff Knutson.
Thank you, Your Honor. I'll start with the Day Report Center update. Probably since we last met, we've actually moved into the new edition of the Day Report Center. That was something that we hadn't planned for this year. COVID came about, and there was just no way for us to get back in there with the spacing as it was. So we did do a build out. The judges took a tour of that about 2 weeks ago, and because it had not been planned or in the budget, we had originally found some funding, but we were able to get that reimbursed by the CARES Act, so that will fall under the grant. So that was actually a really beneficial thing for not only our office but for the county and the taxpayers. So that I think that will be utilized much more efficiently than trying to cram 3 people into the office that we did prior to. So some of the numbers on the Day Report Center monitoring. There are 331 for the month of October that were actively supervised. 288 of those were on bond. 14 were on Huber, 15 treatment court, 23 diversion. Average drug test per day going on was 27. Number of in-person contacts at the Day Report Center for the month was 716. Number of phone contacts at the Day Report Center was 283. Other activities going on, when somebody comes up to court that has a notice to appear, and they are required to come down for mugs and prints, which their original, the incident in question may not have resulted in them coming to the jail the first time, but resulted in a notice to appear. And if they're required to do mugs and prints, before the Day Report Center, they came into the jail through the front door and were booked in, but brought through the jail. That had caused some issues. So the Day Report Center does the bookings. So for the month of October, they also did 62 mugs and prints to book in, book out. DNA collection, they did 56 DNA collections for the month of October. 62 public fingerprints, those are folks that come in for teaching, foster care, a host of other items that they may need public fingerprints for. So that group in there continues to remain very active. In contrast, we look at, the number of in-person contacts for October was 716. In January, we were at 1,230. Obviously, COVID hit the April, we were at 20. So we have steadily increased back up to 716. Number of phone contacts in January was 264. As I mentioned before, this month it's 283. So we are right back at that point where we were before. Mr. O'Keefe had mentioned as he reviews drugs and what we're seeing on the street. Of the violations for October, there was only one that had violated with THC only. So that lends to that the THC is not the drug of choice for those that are on the bonds. It is the meth. And of the 47 that failed their test for October, 17 of those were meth or heroin or some other derivative. 8 of those were the PBT, so they failed the alcohol portion of it. Here's kind of a bigger one that we're seeing is 13 on a missed test. They did not show up for their test. Of those, and here's another interesting one, is new crimes, 0. They had not committed a new crime, which resulted in their getting sent up. I thought that was similar to what Judge Needham had said about they really want to do well. So October, so we had run about 90%. We had gotten up to 92% to the good. We're now 88.98, so we're 89% on the success rate of that group. One of the other things we're seeing a lot more fentanyl in the community. Did another search warrant yesterday with fentanyl. We had a death in the county probably a month ago that during the investigation, fentanyl has been brought up. We're still in the midst of that. So we are seeing more fentanyl getting brought in. And that is an agent that increases some of the highs, but also if it's really deadly if used even a little bit of excess. We Narcaned one back after pursuit last week from heroin. So drugs continue to be quite prevalent in our work. So any questions on the day report center? If not, I've got a couple other.
Any questions? Sheriff.
Thank you. Chris Anderson is up here. She was an advisory member, and since our last meeting, she has now been named the new permanent jail captain. Chris's history with the office is 25 years, and in that is programs. She was program coordinator for some time, so we'll tap into her knowledge as we work at getting the program coordinator up and running. We've had some staff moves, some illness, some other life gets in the way, so we are still working towards that, getting that program coordinator, and I know that will be a big benefit to us as well as HHS getting that connection, as well as the CJCC portion of it. And lastly, the completion of the special needs cells. We just yesterday received the approval for occupancy from the state jail inspector. He came in several weeks ago. We still had a few bumps that we needed to iron out, nothing real big. And then here this week, we finally got the go-ahead. So there are several that are now moved in for occupancy. Well needed space. for these two individuals. We do still have construction going on. We're still getting some jail cells completed, some doors, self-escorting doors. Because there's work going on inside the cells, we are housing several, I think 12 in Barron County, just so we always have one cell block empty to move people around. So with those 12 in Barron County and what we have downstairs, our population is at about 100. We had dipped down to 65. COVID pushed a bunch out. We're working our way back up so that population is starting to return, which is something that we'll continue to monitor. So.
Thank you. And the sheriff hosted a tour, I know, Public Protection Committee a couple of weeks ago, and then the judges and district attorney last week or the week before. And again, those new beds are much needed, and we were very impressed with the work that was done and the benefit, hopefully, that it provides to that particular and growing population in the jail. Any questions of the sheriff? Hearing none. I believe the last document in your packet was the proposed calendar for next year. We'll maintain pretty much the same schedule that we have and that we've adopted as a part of our operating procedures. I appreciate Mike put that out because you all can now get it on your calendars. Hopefully we can return at some point to in-person meetings, but we'll continue to use this technology going forward. I know for some of you it's more convenient to use Zoom as an alternative. So that's the meeting schedule. Any questions or comments about that schedule? If anyone has a request for future agenda items, you can let me know, Mike know, or any member of the executive committee, and we'll certainly be willing to discuss, entertain, and put those on the agenda. I especially encourage, our citizen members to bring up topics, or if there are things that you're aware of in the community that maybe this body could look at. I really think that, input from that segment of our organization is very valued. So if there are things, folks, that you think of or just even want to bounce off us, never hesitate. You have equal voice, and we really welcome your thoughts. Announcements and correspondence, I'm not aware of any. An announcement, as I said earlier, is Mike Niskas has decided to go into retirement. I think many of you know he's relocating to the state of North Carolina. He has a wonderful grandchild who I know he adores and has described as I have better than parenting, to be a grandparent. So we'll be relocating to North Carolina, and as similar to public protection, we want to thank Mike, not only for his service to this group, but service to the county. As I said, he came with a very unique perspective, as Mike had been a DA, was a judge, and then came back to being a district attorney. So I think from the standpoint of the bench, he offered a really unique perspective as having sat where we sit, as well as being a prosecutor. I described him, a public protector, as being an advocate, being passionate, but also being a partner in the justice system. And he has been a very valuable resource to me as presiding, and I know to all the judges regarding his leadership of that office. And we can do nothing but wish him well as he hits those pastures of retirement. And we are, again, excited for him and that new phase of his life, but also you'll be missed, Mike, and I say that with all sincerity. If you were here, I'd give you the certificate that we've prepared thanking you for your service, and we'll make sure to get that up to the office so that you can proudly frame it in your office in your new house in North Carolina. The other thing, and Mike O'Keefe is wonderful, bought a water bottle, and it's emblazoned with the St. Croix County, Wisconsin logo, as well as Community Justice Collaborating Council. So that will be your parting gift for service on the Community Justice Coordinating Council. I wish it came with a check or a Rolex or something, but water bottle is what it is. So we greatly thank you, Mike, and I don't know if there's anything you would like to share.
I'd just like to say that I hope everybody on the committee and the public that participates understands the degree of collaboration that happens in this county with the county board, with the courts, with the law enforcement members, the sheriff, the chiefs of police, with the county administrator. There's a great deal of satisfaction in this work. It's why I've done it for 37 years. There's a certain degree of frustration, and it's a difficult balance sometimes. I will say, and this may come as a surprise to a couple of people, the most satisfying part that I've had here are the people in the treatment court. That work is very important to me. The issues with veterans is very close to my heart. Also, I wish there were things we could do on the mental health side, but that's more complicated because of the statewide program. But I've never left a day in St. Croix County in the last 8 years where I wasn't happy that I was here. And I have about a little over 6 weeks to go. I'm not in the office today because I'm working remotely and with my family in North Carolina. But I will be back, and I will be back to finish out my term next week, well, through the end of the year. So I'd like to thank the courts. I'd like to thank everyone on the committee, the justice partners, for making this a truly blessed experience for myself and my part and my wife. My family has benefited greatly from the ability, short as it is, only 8 years, to be in St. Croix County. And I will truly miss every person who's participating here today.
Thank you again, Mike. Any other announcements to come before the body? Hearing none, we stand adjourned. Our next meeting is January 14th at 8 o'clock.